number one frustration that patients have when they present with recurrent bladder infections is just having ongoing symptoms and having course after course of antibiotics that doesn't completely rid them of their issues. When patients come to my clinic, often they have been treated by their family physicians with numerous courses of antibiotics, which is usually the go-to treatment that primary practitioners will do for patients with these problems. Antibiotics have a lot of risks, particularly when we talk about bacterial resistance, which is a big issue in our medical community, as well as there are numerous side effects that are related to a lot of the antibiotics that we routinely use, primarily issues with liver or kidney disease, and even sometimes pulmonary issues can develop with long-term antibiotic use. Avoiding chronic antibiotic use is the primary thing that we're aiming for when we're treating these recurrent bladder infections. We usually start with a conservative approach when we're talking about UTI prevention. So we first talk about increasing water consumption, getting rid of caffeine, alcohol, anything that is acidic or spicy. And I now in the last year have been routinely recommending the use of Utiva. Utiva has 36 milligrams of proanthocyanidin, which is the active molecule that prevents bladder infection. There is good clinical evidence that has shown that proanthocyanidin prevents bacterial adherence to the bladder wall. Other cranberry supplements do not even mention this active molecule. So I've had numerous patients over the last year have very positive results after chronic use of the Utiva. But in particular, I can recall a patient that I just saw this week who had been having bladder infections every 2-3 weeks, had been on and off antibiotics for over 3 years, and had been on chronic antibiotics for over 12 months. And when I saw her last fall, we started the Utiva as well as the vaginal estrogen because she's postmenopausal. When I saw her this week, she had actually had no bladder infections in the last 8 months, which was a big breakthrough for her, and she noted that she thought it was primarily because of the Utiva.